Welcome to Home Care Connection, a program brought to you by the Rutland Area Visiting Nurse Association and Hospice, dedicated to bringing professional, personal, high-quality health care to you in your home. Today on Home Care Connection, we will be talking about patients with congestive heart failure and how a new collaborative of healthcare providers is successfully helping these patients stay out of the hospital. According to a new federal survey, about 20% of Medicare patients being treated for heart attacks and congestive heart failure or pneumonia are readmitted to the hospital within 30 days. Hospital readmissions are costly, and some can be prevented through care coordination to appropriate follow-up care after the patient has been discharged. Let's hear more about how this group is working and how they're working to keep people out of the hospital for readmissions. We have with us today 3 members of this collaborative group. They are Beth Wilson, a registered nurse and quality improvement specialist with RAVNAH, Darren Childs, who is the Director of Quality Improvement Services at Rutland Regional Medical Center, and Dr. Stanley Shapiro, a cardiologist at Rutland Regional Medical Center. Welcome to the show.
Thank you.
Thank you.
Dr. Shapiro, I think we'd like to start really at sort of the most basic, which is, what is congestive heart failure?
Well, congestive heart failure is a condition essentially where the heart can't meet the needs of the body to perform its activities under various circumstances. So if you look at the body as drawing on the heart's energy, if the heart is ill and has problems, it can't do what it has to do to help people get along and do their daily activities. And heart failure is caused primarily by conditions that either put an excessive strain on the heart muscle or where the heart muscle is damaged and then simply can't function in an optimal fashion.
And not to get too into the medical part of this, but I mean, the heart is essentially a muscle.
The heart is a very specialized muscle.
Yeah.
And it's a complex system that has its own electrical activity, has its own circulation, and has several different chambers that work to meet the needs of the body and the lungs.
Great, thank you. So when we talk about congestive heart failure and why we might be talking about it here in Rutland County, what is the prevalence of congestive heart failure within the Rutland County region?
Well, on a national level, the prevalence is about 5 million people.
Okay.
So, give or take. And I would say that probably 5 to 10% of our adult population has some degree of congestive heart failure.
Wow.
It's a lot.
That is
a lot of people. But cardiovascular diseases are the most common diseases that afflict people in this country, so it's not that much of a surprise.
Okay, right. Because but that would be a larger inclusive group.
Right,
That's
and
more than just
what we
congestive heart
need to
failure.
understand is that whether you have coronary problems, that's problems with the arteries, whether you have hypertension or whether you have valve problems or some other rarer conditions, the final result can be congestive heart failure. So it's sort of a common pathway disease.
Okay. And it is a chronic illness.
It is a chronic illness.
Okay.
Although it can occur acutely, but the majority of cases are chronic.
Okay. Is congestive heart failure a common cause for hospitalization?
It's a very common cause for hospitalization. Along with pneumonia and chronic obstructive lung disease, I think it constitutes the vast majority of hospitalizations that occur in our communities and throughout the country.
Wow. So if you said in the opening that congestive heart failure is in essence, the heart not being able to sort of produce what the body needs to a certain extent. Can we talk a little bit more about what a diagnosis of congestive heart failure actually means to a patient's quality of life, or what's the actual sort of daily impact on them?
Well, when a patient is diagnosed with congestive heart failure, it means that they are going to need to receive an evaluation and ultimately medical therapy that's going to help relieve the congestive heart failure.
Okay.
And we do have diagnostic tools and medications that actually promote survival, increase longevity, and improve the prognosis markedly if patients can come to medical attention.
Wow. And the kind of impact on it, what are the sort of the typical symptoms of congestive heart failure as far as like what a person might experience if they were?
They really constitute a multiplicity of symptoms: fatigue,
Okay.
shortness of breath, leg swelling, inability to do activities, inability to lie down flat in bed at night, sometimes accompanying chest pain or chest pressure.
Wow. And so under normal circumstances, the treatment for congestive heart failure would be?
Well, first you want to make an evaluation, and you need to use some types of diagnostic tools to help decide that it is congestive heart failure, because shortness of breath can be caused by many different problems, such as lung problems or even blood problems. So you need to get a chest x-ray, a cardiogram, do some laboratory tests. Navy employ a technique called echocardiography, which uses sound waves to assess the nature of the heart muscle in terms of its function and structure. And sometimes patients will undergo heart catheterizations to sort out the reasons.
Okay.
Once the diagnosis is made, medical therapy can be introduced, and there's a great deal of medical therapy that is available that will actually not only improve symptoms but make you live longer.
That's encouraging.
Very promising, yeah.
Good.
I think one of the unfortunate parts of congestive heart failure is that, yes, it is, quote, heart failure, but on the other hand, we like to think of it as somewhat of an inefficiency that can be corrected and helped a lot.
Mm-hmm. And again, I think that you know, as we start to move through the next segment of the show, perhaps that's maybe why we have so much excitement about this new initiative, is because there is this promise for when it's effectively diagnosed, and then the treatments can be.
Exactly, and when you use the full administrative apparatus of the hospital and of the outside agencies and the talent and the ability that they bring along with the medical care, you can make a massive impact.
Great. So perhaps maybe we can talk a little bit about a background on how this collaborative got started, and not only in the hospital, but also as it moved out from there.
Yeah, we actually began this initiative back in the fall of 2011. And the Rutland Regional Medical Center was asked by the Vermont Association of Hospitals and Health Systems to begin working on reducing our congestive heart failure hospital readmissions. Okay. And so Dr. Shapiro and I and several others from Rutland Regional attended that kickoff meeting and came back and quickly realized that if we didn't form a community-wide collaborative, that the amount of impact the hospital alone could have was limited, and that we needed to engage our community partners and really look at the systems of care that these patients experience here in the Rutland County and surrounding areas. That was really the impetus for bringing all of these different groups together.
Okay, and again, this is in part because of sort of a heightened awareness of what it really takes to help patients manage chronic illness, as opposed to more acute things like like a heart attack, as opposed to congestive heart failure, right? It requires more of an understanding of lifestyles and things like that.
Yes, as Dr. Shapiro mentioned, it is one of the leading causes for patients being hospitalized, both here locally as well as nationally.
Yeah.
It's expensive to treat and manage, and the
Absolutely.
hospital part of that equation is the most expensive. And that the readmission rate was too high, not just here in Rutland, but nationally, and that we need to do something different to lower that rate.
And so let's talk about it a little bit, because that is certainly a factor in this. When a patient with congestive heart failure leaves the hospital and they are readmitted within 30 days, what happens?
If they come back within 30 days, we actually have a clinical and administrative team that does a review on that particular patient, their treatment, the follow-up care, and so on, to try to identify some of the things that we could have done different or additionally for that patient to help them get the care and treatment they need out in the community once they've been discharged, so that they're educated about their condition, they learn how to take care of themselves, they know what resources are available to them, so that ideally they won't come back unless they truly need to.
So is it the case that a person who is readmitted with symptoms or conditions, is it related only to the CF, the congestive heart failure diagnosis, or?
No, it's not. We actually look at what we call an all-cause readmission. So anytime the patient
okay.
is discharged with congestive heart failure, if they come back within 30 days for any reason, we're going to take a look at that. Because typically these patients have other conditions, other health challenges, other social challenges that we can help meet as well.
Well, and when Dr. Shapiro was talking about some of the impacts of congestive heart failure on a patient, it's pretty clear that they can span a wide range of activities of daily living. So it's not surprising that that sort of analysis, that diagnosis would be more comprehensive if they get back in.
Yeah, the actual rate for CHF patients who come back within 30 days for CHF is lower than 20%. But again, we want to treat the entire patient, not just the disease.
Absolutely.
So.
Great. So there are serious chronic illnesses afflicting the elderly. Why start with congestive heart failure?
Really going back to the prevalence rate in the community, it is one of the leading causes for patients to be hospitalized.
Okay.
Looking at that readmission
That makes
rate,
sense.
roughly 1 out of 5 patients coming back to the hospital within 30 days of discharge. That's too high. It's one of the highest, if not the highest rate we have at the hospital is for congestive heart failure patients.
Yeah.
So we said there's opportunity there. By working together, by making some improvements, we can do better for these patients. And that was really the driving force.
That makes sense. All right, so you had mentioned a couple of the partners, but who really are the sort of partners in this collaborative?
We've got, I think, a great set of community partners to work with. Certainly the hospital, and we have multiple departments represented, such as social work, case management, nursing, obviously. Dr. Shapiro from our Heart Center as a clinical lead on the project, a number of others. But then other organizations, including the 3 skilled nursing facilities here in the area. Mountain View, Genesis, The Pines, and Rutland Health and Rehab are all participating. Our 2 home health agencies, RAVNAH and Beata, are participating. Primary care physicians like Dr. Bruce Bullock and others from our community health centers of Rutland region. A great group, probably 20 or so different organizations, all coming together. We meet monthly as a large team. There's work that we conduct in between the monthly meetings. We share the findings of our clinical case reviews. And as I say, over the 2 years, we've been able to actually make some improvements, improve the care and treatment of these patients, the resources available to them, and lower that readmission rate.
Well, and I think that's a good segue, because I think that, it would be interesting to know what the readmission rate was when or before the initiative started, at least in Rutland County or Rutland Regional.
It varies a bit from month to month, but typically ranged 20 to 28%. That was our historical range.
And then were there goals set for what might be a good outcome if the initiative were to be successful?
Yeah, we had actually set a target of about 18.5%. It's a mathematical calculation that we did to bring that rate down so that it was statistically significant. And we've been able to reduce that. Again, it varies from month to month a little bit. Some months we've had 0. None have come back.
That's exciting.
And other months, the average has been between 16 to 18%, so just below where we wanted to be. So we've really achieved that target. The numbers, the absolute numbers are fairly small.
Right.
It's the rate that typically gets reported.
Well, again, and I mean, I think that we live in a rural community, so I mean, the physical numbers are going to be what they are because when the population is what it is.
Yep. And for the patients that we are making a difference,
absolutely,
I mean,
that's the key.
That's what it's all about.
And it really does sound like this team that's been created provides that sort of a continuum of care?
Systems of care, correct. That we say these are our patients.
Right.
We all have a stake in making sure that they're getting the right care at the right time, the right place.
Yeah, that's great.
And working together as one big team, even though we're separate organizations, that coming together and focusing on the systems of care is really where we've been able to make the improvements.
So speaking specifically then about Rutland Regional Medical Center for a moment, is this different from what other hospitals are doing to improve congestive heart failure readmissions?
I think that we're a role model. I think we're out ahead of many other hospitals, that we've had this great willingness to participate in this coming together, building relationships, building trust among all these partners, sharing data, changing our processes. The spirit of cooperation has been terrific, and we've got the results to show that it's making a difference. So I think we're a role model. for others. I think we're ahead of the curve.
No, and again, I think, you know, the fact that the team is as expansive as it is, and the fact that you are really allowing for there to be sort of communication between these groups from the hospital to whatever might come after that, whether it's a nursing home or in-home services, and then wherever that might go afterwards. I mean, this really is a comprehensive program that sees patients, you know, over an extended period of time, and allows for, I'm guessing, some measurement of their outcomes and their progress.
Yes, and I think what we've talked about within our team, within the collaborative, is that this has been so successful, now with a lot of hard work,
Yeah.
and
Oh,
by
yeah.
the folks participating, but it's been so successful that we'd like to use this as a foundation that we can build on in the future to look at other conditions and diagnoses and make a difference for those patients in the care they receive.
Well, and again, I mean, not to get too deep into the broader concept of healthcare, but this really is a shift in focus, looking at the outcomes as opposed to treating the symptoms, and then bringing together the partners that can best achieve those outcomes is I think, certainly a sound approach to stuff.
Yes, one of the other things we've done, not to get off topic too
Yeah.
much, but is we've submitted an application to the federal government,
Okay.
the Centers for Medicare and Medicaid Services,
Yep.
CMS,
Yep.
as they're known,
Yes, indeed.
for something called a bundled payment pilot.
Okay.
Bundled payment. And basically what that means is, as we've been talking about, a group coming together, different organizations,
Mm-hmm.
working as one large team to make improvements in quality of care, improve the patient experience with all the different groups
Yep.
and people that come into contact with, and ideally, because we're doing those things well, lower the cost of care. So
Absolutely.
we've had that application accepted by the federal government, and that's beginning basically now.
That's cool.
Yep.
That's good.
Yep.
So, so we know why we're here. We're talking about congestive heart failure, and we understand this collaborative. And Beth, you know, since this group was formed, it's developed successful methods for, you know, transitioning patients from the hospital and keeping the readmissions low. Can you tell us a little bit about what RAVNAH is doing in this collaborative?
Certainly. So to quote Dr. Shapiro, I think it's dawned on us all that it kind of takes a village to
Yeah.
take care of patients.
Well, that's quoting Hillary Clinton.
I think that was taking care of children. To raise a child, it took a village. But we kind of took the perspective when we came together in this collaboration is how can we, as all these different entities who provide care to patients, do a better job in helping patients stay out of the hospital. I think we all agreed that most patients don't really enjoy being in the hospital. It's not a real place that you enjoy spending a lot of time. So we kind of try to look at how we all do our jobs differently, and we can improve on how we transition care from a hospital acute setting into a home care setting. So from a home care perspective, we try to look at the things that we did for patients to try to keep them healthier and out of hospitals. One of the things that we focused on in home care was how do we make sure the patient's getting the medication that they're ordered to get in the doses they need to take and taking it as prescribed by the physician, because medication management is a huge component in controlling congestive heart failure, as is diet. A lot of patients are sent home on a sodium-restricted diet or a low-sodium diet. But when I look in my food pantry, do I have any awareness that 90% of the foods I have at home I should not be eating? And so from a home care perspective, education is a large component of getting patients to understand what is allowable in a diet, how to manage their medications appropriately according to the physician's orders. Another thing that's important for patients with this particular disease is to have an understanding of the symptoms that tell them they're getting out of control early,
Right.
rather than waiting till it's so out of control that my options for treatment are limited to a hospital stay. So it's that educational component of understanding my disease and the symptoms. There's also a component that's important for patients to monitor vital signs. Specifically, I need to weigh myself every day. And I need to understand that when my weight starts to increase in a very short period of time, how that's associated to this particular disease of congestive heart failure. So from a visiting nurse perspective, we focused on what we could do as an agency to improve those educational components and to get patients where they could do the monitoring aspect of their disease specifically for weighing themselves. We have a program at the visiting nurses that utilizes equipment called telehealth. A patient weighs themselves, checks their blood pressure, checks their oxygen level on a daily basis, and a RN looks at those results every day and communicates with the patient about the test results. This equipment also sends the patient educational information about sodium-restricted diets, about what their disease process symptoms are. So that has a multifaceted approach to education for the patient as well as the testing of some vital signs. What we found when we looked at our data from the time point of May of 2012 to May of 2013, we had 52 participants utilizing our telehealth program. Of those participants, the vast majority, as in everyone except one person, was on telehealth specifically for congestive heart failure.
Oh, okay.
We looked at those patients and we wanted to know, of that group, how many had to be rehospitalized within 30 days for congestive heart failure. We found that only 5.3% of the patient who used telehealth had to be rehospitalized for congestive heart failure. It's a pretty nice finding when you look at the statistics we're talking about.
Well, and again, trying to stay on topic, but also needing to talk about some of the things that are relevant to this particular topic. It seems to me that kind of education, the advantage that home care can provide in this type of collaborative is because a lot of the management of these types of diseases requires sort of an adherence to some habitual behaviors, being able to be in the home and provide that education as well as that real-time management of information seems fairly important.
I think it's certainly a large key in how we can help patients stay as healthy as possible and minimize the return rate to a hospital. One of the things that came out of the collaboration is a patient education book that was developed by all the members of the collaboration, was spearheaded by the hospital, and that patients receive when they're hospitalized and take home with them at their discharge. And in that booklet is a great deal of written information for patients. What does congestive heart failure mean? What are the symptoms that tell me I'm getting into control? How do I know what my changes in my weight indicate? There's a lot of excellent information that is part of that came out of the collaboration. And I know that Darren has been very instrumental in helping us get that from a what do we think this is going to look like trial to an actual handbook that patients get to take home with them.
That's and it seems like we may actually have it with us.
And we actually have one with us.
have the small
So
version.
this is a small version. Patients get larger ones because,
Okay.
of course, it helps to have something you can actually read in large print. And it's about a 30-day workbook for patients.
Okay.
There's places they can write notes about how they're doing with
Yep.
their congestive heart failure, what their symptoms are, how their weights are doing. They can take this with them when they go see their cardiologist, who can review what their testing results have been and days they may have had a bad day, what their symptoms were. So this has been a very big piece of helping us as a community give patients information in writing that's easy to understand, and also helps patients know, well, how am I going to manage this long term? I may have 30 days I don't want to go back to the hospital, but I'm going to have this disease that I need to know about for the rest of my life. How do I manage that?
Well, and in fact, I mean, this seems to me very much consistent with, the idea that in order for behaviors to become habitualized, one has to practice them over a period of time. And usually they talk about a 30-day window for when those behaviors can become habitual. But also, it seems to me that this would provide and give the patient the ability to really take some ownership of the management of the disease. Is that part of the...
I think that's correct. I think that for anyone to make changes is pretty tough.
Yeah.
I think that by the time people are in their mid to late adult stage, they're very habituated toward what they eat, how much exercise they like to do, how capable they are of taking care of themselves. So that having the opportunity to make some changes and to be educated how to make those changes can be very valuable to put their well-being in front of themselves. And we do the best that we can to help them understand what's going on, because people don't quite understand why they get sick a lot of the time.
Right.
And we're stepping in to try to help them understand those factors.
Well, in a disease like congestive heart failure that has the multitude of symptoms that you touched on earlier, my guess would be that it wouldn't sort of be something that a non-medical person would instantaneously go, oh, I get it, I'm gonna be impacted in all of these ways. So that information probably helps them understand the sort of track of the disease as it goes.
Right,
over time.
and what I would really want to emphasize is that the two major causes of congestive heart failure in this country are coronary artery disease, that is hardening the arteries of the heart caused by atherosclerosis, and pretty strongly hypertension. And those conditions, to a good degree, if you start your lifestyle early on in life, not smoking, not eating processed food, avoiding processed starches, not eating fats, and getting exercise, that by the time you're in your 40s and 50s, you stand a much better likelihood of not getting the problems that cause congestive heart failure.
Right.
So public health and education are the pillars by which we can really prevent the massive cost of these diseases as they occur.
So now Beth touched on the fact that that all but one of our telemonitoring patients had congestive heart failure. Have you found the telemonitoring system to be a help in this battle against, or at least in...
Well, obviously the
educating?
statistics don't lie. So I think that the initiatives and the expertise of the home health agencies and RAVNAH have been very high in developing these efforts that are contributing vastly to people feeling better and doing better. So I'm all for it. I think that it's worthwhile. Remember, the biggest costs that we incur are in hospitalizations and in patients that have conditions that are irreversible.
Right.
So that anything we can do to forestall those types of efforts contribute to the national effort of decreasing healthcare costs, which is fairly prominent, I think, these days.
Yes, that's fair to say. So, right. So, is this sustainable? I mean, can we keep these percentages of readmissions low? Can we do this over the next 10, 20 years?
You know, I think we can. I think this experiment that we have been working on has proven successful. We've learned a lot along the way, and we know where we need to focus our efforts.
Yep.
What we're really trying to do now is to make sure that all the changes we put into place are what we call hardwired. But they're really going to stick, and to your point, last over the years.
Yeah.
And I believe with a little more effort, they will.
Well, and again, and I'm at heart a systems guy. Human resources is a systems-driven profession, and there's no question about it. If you want it to stick, you have to have the systems in place. And it sounds like this collaborative really has, with the work that started it off, it really has developed some good systems, and more importantly, ones that see the patient through the various stages of care. So that sounds very, I think I agree. It's very encouraging to know that this collaborative exists the way it does. So fine, I think you did talk a little bit about this earlier, or maybe I thought you did, but just one other question before we stop, which is the collaborations between various health providers and social services. Do we think that this is a model for the future, as far as whether it's healthcare, managing healthcare costs, the larger issues? I think.
Well, it's not just a model; it's a mandate, because the fee-for-service practice
Yep.
of medical care that has existed in this country is now being thought by the people who have the pay for the system. That is
Yes.
CMS and the federal government and the states. They are expecting this type of collaboration, and they will reward that collaboration to our knowledge.
Yes.
And there's a change that's coming,
Yes.
and it's starting now. And in Rutland, we expect to be in the vanguard of that, honestly. And as a strong community hospital with great leadership, we'll certainly achieve that. I have no doubt about it.
Good. Well, as surprising as this may be, we are out of time. So I would like to thank you all for being on the show. I hope that I believe we were certainly able to provide the public with some really important information about congestive heart failure, about this initiative. But I think also it speaks to the commitment that we in Rutland County, the healthcare providers in Rutland County, have toward this larger goal of real sustainable good health for community members. Our goal is to keep you informed about the many programs and services provided by the Rutland Visiting Nurse Association and Hospice and our partners. If you have any questions or would like more information about the show, please call us at 802-775-0568. Thank you for joining us on Home Care Connection today, and we'll see you next time.